Hello, my name is Michelle Peacock and I'm doing my snippet on heart failure. Heart failure is a chronic debilitating disease that decreases patients' quality of life and increases their hospitalization needs. They experience many symptoms such as shortness of breath, fatigue, and edema. There are many comorbidities, including hypertension, diabetes, valvular disorders, infection, and inflammation. Heart failure is caused by any structural or functional cardiac disorder that impairs the ventricles from filling or ejecting blood. This impairment decreases cardiac output, decreasing arterial pressure, which stimulates the hypothalamus to release vasopressin. Vasopressin then stimulates the kidneys to increase their water and sodium reabsorption. There are three main compensatory mechanisms in heart failure. One is the Frank-Starling mechanism. This increases cardiac output by increasing preload. Number two is the remodeling of the ventricles through the increased volume and the thickening of its walls. Finally, there is an augmentation of mean arterial pressure through the activation of the neurohormonal system. Diagnosis is made based off a clinical presentation and echocardiogram. The echocardiogram is the gold standard because it shows the ventricular size and function. Treatment is aimed at improving symptoms, decreasing the deterioration of heart failure, reducing mortality, and improving quality of life. There are three main medication types that are given for patients with heart failure. Number one is diuretics. They decrease sodium and chloride reabsorption, increasing the ions in the tubules of the kidneys, which increases water diuresis. This lowers the overall fluid volume in the system and decreases volume overload. Number two are ACE inhibitors. These angiotensin converting enzyme inhibitors decrease the formation of angiotensin II, causing a dilation of blood vessels, lowering blood pressure, decreasing the blood pressure the heart must work against. This improves hemodynamics and improves kidney function. Finally, beta blockers block neurotransmitters norepinephrine and epinephrine from binding to receptors. This allows the heart to relax and beat more slowly and reduce the amount of blood the heart must pump. This overall improves survivability of these patients. Other potential medications include hydralazine, nitrates, digoxin, antiarrhythmics, and aldosterone antagonists. Other things to consider are treatments for the causes of heart failure, whether it be diabetes or hypertension. There may be some other interventions, including device insertions such as an internal cardiac defibrillator to deal with any arrhythmias, or surgical interventions, whether it be a heart transplant should heart failure be severe, or revascularization if the cause is through myocardial infarction. There are many educational topics that need to be discussed with these patients and lifestyle modifications that need to be made. These patients need to stop smoking, they need to stop drinking alcohol and doing illicit drugs. They need to control their sodium intake by reducing it to less than 3 grams a day or maybe more if necessary. Fluid restriction may be necessary if they're having severe heart failure. Finally, they need to manage their weight and monitor it daily with daily weights, and this is to help them recognize if they're having an increase in volume status to help prevent them from having a volume overload. There are no real genetic or environmental factors that contribute directly to heart failure, but they do contribute to the diseases that can cause heart failure. Education is key with these patients. They must maintain their medication and follow these, or they will be readmitted many times. Thank you.